Welcome back. How's Liam doing?
So, unfortunately, Dr. Lee, Liam has been falling a lot more often. Um, his calves have actually been much larger than other boys his age, and every time in preschool, he just seems to not be able to pay attention and he can't keep up with friends on the playground.
I just feel weak and I get tired really fast, and I don't get to play with my friends like my brother does because I just get so tired and they can go faster than me and they don't want to play with me even because I'm too slow.
I'm sorry to hear that. Let's check out the test that we did for you. So I have here an immunofluorescent stain for dystrophin, and if you compare it to a normal muscle tissue, then you can see that dystrophin is missing in your son's tissue. And also the genetic testing that we've done shows that there is a mutation in the dystrophin gene, which accounts for the lack of dystrophin in your son's muscle tissues. And this all points to Duchenne muscular dystrophy, which is a progressive muscle wasting disease where dystrophin is missing, so that makes the muscles more susceptible to injuries. Do you guys have any questions about the disease or anything?
Is there any treatments that can help my son? Or
Research is still ongoing to find the best cure for DMD, but there are a bunch of treatments that have been tested and have shown signs of lessening the severity of the symptoms in the disease in general. There are also a lot of DMD experts and clinics and centers that you can go and talk to professionals just to get their perspective on the best way to approach this disease. Yeah. But for now, let's start on some corticosteroids and some physical therapy just to build up muscle strength. And I'll order another genetic testing just to see where if we can determine where the mutation is in DMD, because that will help us a lot with treatments.
Is the physical therapy gonna hurt?
No, physical therapy is going to be challenging, but it should be okay for you. Remember, it's just to build up muscle strength, and it's not to strain you or hurt you or anything. Yeah.
thank you.
All right, then I'll see you guys next time. Welcome back, Liam. You've grown.
Nice to see you again, Dr. Lee. So Liam has actually been doing worse. Now that he's in the fifth grade, his friends really don't want to play with him, and it's really hurting his social life. His gait has been much worse, and he actually needs a walker. And the school has actually even given him like a special aid just for his classes.
And my joints feel really stiff. Like I can't move my limbs as well, and I just feel so weak and weaker every day. And I'm just scared because I know DMD patients often end up in wheelchairs pretty young, and I'm scared I'm going to be in a wheelchair soon.
Well, I'm really sorry to hear that things are getting more difficult for you just to get around. But let's see where we can go from here. The last genetic testing we did showed that you had a nonsense mutation in the dystrophin gene. And so I just want to let you guys know that there's actually a clinical trial right now that involves a drug that targets this type of mutation in DMD patients. And the drug is called Adalurin. If you guys can search it up or talk to other people about it, but it's quite promising, and I can show you a video about how it works actually to see if you're interested in taking part of this trial.
Translarna, Atelorin, is an exciting new treatment option from PTC Therapeutics that is being tested for use in genetic diseases that are caused by nonsense point mutations. Atelorin has the potential to treat a number of genetic disorders, including cystic fibrosis, and has shown promising results in animal models and early human trials for Duchenne muscular dystrophy. In DMD patients with a nonsense mutation in the dystrophin gene, they have an incorrect codon that results in translation being terminated prematurely and a truncated, unstable dystrophin protein being produced. Atelorin is thought to function by interacting with ribosomes in order to facilitate recruitment of near-cognate tRNAs that allow the ribosome to read through the premature stop codons and produce full-length dystrophin protein. Near-cognate tRNAs are tRNAs with an anticodon similar enough to that of release factors in order to base pair with the stop codon within the ribosome. Instead of resulting in ribosomal release from the mRNA like release factors normally do when a stop codon is encountered, the near-cognate tRNAs translate the stop codon into an amino acid, and translation is continued. Promising results include that in a phase 2A human trial, 61% of subjects showed significant increases in dystrophin expression after only 28 days of treatment. One of those subjects' immunostaining is shown here. Additionally, as shown here, in MDX mice, atalorin, shown in the diagram as RTC13, was shown to increase dystrophin expression, including in the diaphragm and heart, and improved muscle strength in all treated animals. It also significantly decreased serum creatine kinase levels in mice. So far in testing, atalorin has a very good safety profile with no serious adverse events. However, it has been found to cause nausea, vomiting, and abdominal pain in some patients. Please talk to your doctor to see if enrolling in a trial for atalorin is the right treatment path for your genetic disease.
So that was the commercial. To summarize how the drug works, it basically causes the translational mechanism to skip the premature stop codon and allow for a full-length dystrophin protein to be created. Success isn't guaranteed because it's still a trial. Results from some trials didn't show significant improvement, but the results vary from patient to patient. And it still has potential to be a really good treatment. So I think you should consider it. If you sign up for this trial, you'd be helping future research towards a treatment for you and other boys with DMD. So just please consider it. I think it's a good option.
What do you think, Liam?
I mean, I think it sounds like something that could help me get better. I think we should try it.
Okay.
Cool.
I think we'd consider it, yeah.
Okay, well, here's some paperwork stuff you guys can look over. Welcome back. How are you feeling after being in the trial for the last few months?
I think I'm still weaker than my friends, which, I'm kind of sad about. But I'm starting to feel a little bit stronger, maybe. I don't know. I don't think I've gotten worse in the last couple of months, which I was getting worse really fast, I thought, before. So.
That's good. That's good to hear. How has the trial been? Have the researchers been nice to you?
Oh yeah, it's been great. The UCLA researchers are really nice, and they really want to help me, which feels good.
That's great. That's good to hear.
I feel very hopeful from the atalorin trials, and I'm just so glad that Liam was able to participate.
Well, I'm glad to hear positive reviews from the trial itself. So let's take a look at the results. Here's a muscle biopsy taken this week compared to the one from before the trial. And so you can see that we're getting significantly greater dystrophin expression in your muscle cells, which is a good sign. We're also seeing that your 6-minute walk test distance is decreasing slower than it had been before we started the treatment, and that your creatine kinase levels are a little bit lower. And so these are signs that you are improving for DMD. And so that's really great. Thank you for participating in the trial.